We are delighted that Dublin's Q102 have paired with the wonderful Cystic Fibrosis Ireland for the next year. You'd often hear it referred to as CFI, and we're going to be backing their campaigns throughout the year, as well as hearing from just some of the roughly 1,400 people living with the condition to educate and I suppose inform us all. It's something that we hear a lot and maybe that we don't know enough about. And Rory Tallon is a CF advocate with CFI, and he has come in to chat with me this morning. Rory, lovely to see you.
Good morning, thank you.
So we were saying that we know somebody, actually, Sue, who is one of the CF nurses in Vincent's, who I used to live with. So I would be kind of fairly up to date with the condition. But let's start with the basics for those that don't know. What exactly is cystic fibrosis?
So CF for short is a genetically inherited condition that you live with for life. So you're born with the condition. It's predominantly a respiratory illness. It affects the lungs mostly, but it's actually multi-organ illness. Other organs severely impacted would be the bowels, especially in the gut. Digestion, about 85% of people with CF would be pancreatic insufficient. It means that you can't essentially digest your food. So you need to take supplemental pancreatic enzymes to digest your food.
Okay.
Other organs can be involved, like liver disease. You can have kidney issues as well, and about 30% or so of adults with CF will develop CF-related diabetes as well.
And you're talking about adults there now, but when typically does it get diagnosed? Does it get diagnosed early?
Yeah, so fortunately now we have the neonatal screening programme. So in 2011, CF was added to a panel of illnesses and conditions that are screened for at the heel prick test when the baby's newly born.
Yep.
So most people now would be diagnosed through that screening program. Prior to 2011, people with CF would have been diagnosed through symptom presentation, and very often symptoms might have gone unrecognised or treated as another condition, maybe treated as asthmatic or something. And so even to this day, you get an exceptional individual might be diagnosed with CF in their adult life, and they've been treated as some other respiratory sort of complication all their life,
And we'll talk about symptoms in a sec, but the rate of CF in Ireland is particularly high.
It is. We have the highest incidence of the worst version of CF.
So why is that? Do we know? Is it genetic? What?
Yeah, a small genetic pool, I suppose, within Ireland. But we have a high carrier rate in Ireland. So 1 in 19 of the Irish population would be a carrier for a CF gene.
Okay.
So basically it's genetically inherited. So if you have two carriers that start a family together, each child that's born will have a 1 in 4 chance of being born with CF, 1 in 2 chance of being born as a carrier of the CF gene, and a 1 in 4 chance of being born unaffected by a carrier or a CF. So, you have a lot of families that might have maybe a second or third child might be diagnosed with CF, and it turns out then they get their first 2 or 3 children tested. And they may be carriers, or they might have undiagnosed CF. That'd be more historic, because most, as I said, are picked up now through the heel prick test screening. Yeah.
Sure. So can I ask you then about symptoms, or just you personally, how has it affected your life?
Yeah, well, growing up, I was diagnosed at 2 months old. I failing to thrive, which means basically through all my feeds, I wasn't gaining any weight, and I was quite chesty and coughing and so on. So I was, I was in hospital, from birth, and when I was about 2 months old, then they diagnosed me as having CF. So
back in the day, you were kind of lucky to get that diagnosis when you did.
Yeah, it was, because the earlier you start the treatment, this is very important, and that's why the heel prick screening test is very important.
Amazing.
To start treatments early gives you a better chance in life. So as a child, I would have always been coughing, day-to-day coughing, waking up coughing, mucus congestion in the lungs. That's typical of CF. And then I couldn't digest anything, so I needed pancreatic enzymes. But once I started my treatments, then I began to, grow and develop and so on.
And so what are the treatments? What's
so
all sorts of different medications?
So I'll start now that in this era now, we're very fortunate that we have a new class of drugs that can actually help treat CF. But prior to 2013 in Ireland, all the treatments for CF were treating the symptoms that were presenting. So those symptoms would typically be chest infections, shortness of breath, asthmatic type, bronchial restriction, constriction, and so on. So recurrent chest infections. And complications of the bowels and so on. So people getting, blockages, bowel blockages, and relying on laxative sort of treatment to keep their bowels working. But with that cramping and pain and discomfort and disruption to daily life.
Yeah,
and,
huge.
And for children, that affects their ability in school or their availability and their attendance at school. You're missing, historically, certainly missing weeks of school because hospitalized for a chest infection. So with CF, a chest infection is quite a serious thing. So, a healthy person in the population, if they get a chest infection, they probably take a course of 5 days worth of oral antibiotics and off to go about their business again. With CF, it's typically 2 weeks of intravenous antibiotics, and that requires hospitalization. And then, you just don't finish your IV antibiotics and bounce back. It might take a few days recovery. So every time you get sick, you don't know. Sometimes 2 weeks of antibiotic treatment is not enough. Maybe the antibiotics don't work and you need another 2 weeks. So suddenly one chest infection, it translates to 4 weeks in hospital. And that's a very common experience for someone with CF. So you can imagine if you're in school or in college or in the workforce and you get a chest infection, the impact that has on your life and then on those around you, your family and so on, and friends, So that's managing the primary challenge, which is the respiratory aspect. But you still, historically, people with CF, they needed pancreatic enzymes, 85%. Now, there are a few that don't need pancreatic enzymes.
Okay.
But with CF, because of constant inflammation and infection in your lungs, repeat infections in your lungs and so on, your body needed more nutrients than others. So you'd have to eat very focused diets, like high energy diets and so on.
Yeah, I'm looking at a typical day here of a life of somebody living with CF, and actually how you have to monitor and really you'd be very careful about what percentage you eat for lunch, what percentage you eat for dinner.
Yeah. So we're fortunate now, as I mentioned, there's a new class of drugs called CFTR modulator drugs.
Yep.
And for anyone lucky enough to be eligible to take those drugs and they're able to tolerate those drugs, they are mitigating the extent of CF that you have. Because, as I said, prior to 2013, when these drugs came on stream, all the treatments that were available were just treating the symptoms that came at you. Whereas these are actually working at the root cause of CF, so they're mitigating the extent. So now people with CF who are doing well on some of these modulator drugs, they have to reduce down what they've been eating all their life, the way they've eaten all their life, because they don't need as much nutrients as possible. But that's fine when you're stable and doing well on these drugs. But there are still people who aren't, the drugs for whatever reason aren't as effective. So they will still need. And there's a few that, unfortunately, their version of CF means there's no drugs available for them.
Okay.
None of these modulators available for them. And they still have to follow that traditional diet approach to managing their CF.
All right, well, let's chat fundraising, because we've come on board. You've got a big event coming up soon. Tell us about Head2Head.
Head2Head, it's a fabulous walk. And fortunately, over the years, this will be our 13th year. We usually get amazing September sunshine for it, so hopefully we'll get that again this year. So
of course we will.
We will. It's a walk from Howth Head to Bray Head.
Yeah.
So you can do the full walk from one stop to the other, or you can do it in sections. You could do Howth to Sandymount, or you could start at Sandymount and go from Sandymount to Bray. So you can do either of those versions. You could start in Howth, finish Sandymount. So you can do almost marathon distance. So you could do, each leg is about a half marathon approximately.
Brilliant.
So it's a walk. So it's lovely. It's a lovely day and usually big crowd.
It's a great walk. And actually,
atmosphere.
we've had Sarah Hanrahan, who we're going to be talking to in a couple of minutes. She does our things to do in the city every week. Yeah. And she did it a couple of months ago and did the whole thing. And it's absolutely amazing.
Down the Clontarf coast, it's lovely.
Yeah. Sounds great. Okay, so people can get involved. It's the Head2Head Walk for CFI. It's going to take place Sunday the 7th of September, and all the information is available on cfiireland.ie. Rory, thanks a million for coming in and explaining what exactly CF is. We are, as I said, delighted to support the charity this year right across the station, and we'll definitely be seeing more of each other, as they say.